Hey, everybody, welcome to the show. Today, we have a guest that owns multiple companies, but we're going to highlight one of those companies, Coast Diagnostics. Coast Diagnostics was a small lab here in town that saw a need, brought in the tools it needed, moved to a bigger space, hired the people, the best people to make it happen. And now he's COVID testing for not only doctors, but also businesses. Not only has Brian Ward been able to see a need and make it successful, but he's also going to talk about his employees. And he doesn't call them employees, he calls them his team. And his goal for them to have work-life balance as much as himself as a business owner is huge. And he's going to give us the information and pointers of how you can take your company by making your team winners, make your business successful. Hey, I'm Karen. I'm a former CPA, entrepreneur, business consultant with big ideas, and I'm the mom.
I'm Katie. I'm a payroll specialist, business owner, and detail-oriented person that makes things happen, and I'm the daughter. Welcome to Cheers to Business.
Brian Ward, welcome to the show.
It's good to be here. Thanks for having me today.
Brian, tell us who you are and what you do.
I'm the CEO of Coastal Diagnostics and DocRx here in Mobile. We do healthcare in terms of medication dispensing. We have a billing company here in Mobile called ClaimPay that does billing. We do medical supplies to doctors' offices. We do injections, and we also do flu kits, flu tests throughout the country with strep and mono. And we also own a lab here called Coastal Diagnostics that I mentioned a minute ago that does testing from COVID testing that's currently going on right now to PCR testing to toxicology testing for doctors. So really and truly, we do a lot of ancillary services and products for doctors and patients.
Brian, you and I have known each other a long time. Do you remember what year it was we met?
2009, maybe 2008.
Yeah, I think so. You had one company, and now how many companies do you have?
5, actually. One has turned into 5. So it's gone from a husband and wife working out of a small office in a house to 3 different office buildings and a little over, it seems like over 100 employees, but it's definitely grown a lot bigger than I thought it would be.
Well, I'm happy to say that I've been a part of your team in one fraction or another along the ride, and it's definitely been an exciting time.
Well, you can't do it without a great accountant and CFO. So that's probably what's helped us move along the most is looking at the things that we did, the costs and everything else, and trying to figure out what we can and can't do financially. And that's you've helped us a lot with that.
Well, I'm excited to say I'm on board to help now and in the future and to see where this thing can go. You're already national. But the thing I want to concentrate today on as we are coming out of this COVID pandemic scare or whatever you want to call it is Coast Diagnostics. Now, you already had this in place before this virus ever showed up, right?
We did toxicology testing, mostly for physicians and patients so that we could help prevent drug diversion where doctors were prescribing controls and patients were trying to sell them on the street. We wanted to make sure and test patients to make sure they were taking their medications. We also wanted to test for illicits and things that patients were taking, but we also used it, the toxicology side, previous to in years past, to make sure patients were taking the right medications and had the right amount in their system when they took their medication. So it was really more of a patient monitoring lab, but it's grown into a full lab with tons of services that it offers, and COVID being one of them.
Now, you're only, for us here locally, because we have national listeners, that we had there's one other lab in town that was doing the testing, but you're the second lab to go in place in this area. Is that right?
Correct.
You've brought people in from all over, and I know you've also bought machines to do the correct testing for this COVID. And so do people have to have like doctor orders, or can they just call you up and go, I want to test for COVID?
Well, what we do, we work with doctors' offices, businesses alike, use healthcare professionals to do the testing. We actually can go in and have portable testing sites put up with cities, city leaders, and do things on that end. So it's a multiple array of testing that we do, but we don't send them out to patients' homes and do that type of thing. It's done by healthcare professionals, and it's done in many different avenues across the country right now with what we're working with.
So if I owned a company I do. So I want to get everyone tested at one of my companies. I would just call. How do I get in touch with you guys?
Well, we've got our local number here is 251-459-8409. But you can call us and we'll arrange everything with you, work with you to get healthcare professionals on site to be able to test all your patients.
Health insurance will cover it if my doctor orders it. So it's a 2-part question there. The first one being, how does the test get to you? And 2, if I go, the insurance is going to pay for it, but what about a business? So they just write you a check? I mean, how does that work?
So basically, we provide the supplies. The doctor will test you, a courier will come and pick it up and bring it back to the lab. We'll run the results and get it back to you, usually within 24 hours. In terms of the billing piece, we bill the insurance, so we'll get your insurance information from your employer or from the physician, and we will bill that test for you.
All right. So what if I'm a business and I want to test all my employees?
Same thing. We'll either use your business or you can. We have a cash fee, and we'll handle that with the owner of the business, and he'll have a healthcare professional come in, and we'll do the testing and then charge a flat fee.
All right. Now, you already had the lab. It was on a very small scale. And now, how many jobs have you added in expanding this lab for all this testing?
We probably have added about anywhere between 7 and 10 people. The truth of the matter is we run a smaller facility, and we just outgrew it. Being national and taking on the labs that we've taken on, it's and accounts we've taken on, it's just, by the time you add more machines, more people, you kind of outgrow your space. So we've grown into about a 5,000 square foot space, which is pretty substantial for a lab. Brought in people from, across the South to work that were experts in what they do, and really increase the size of the lab, increase the personnel in the lab, but also increase a lot of the testing that we're doing. And currently right now we're working with a few hospitals to do some partnerships with them. So it's a lot going on.
Now, I think it was you, the mayor was talking about when all the height of all this virus was going on. Is that correct?
Yeah, he mentioned us a few times in some of his press releases in Mobile, but he's done a really good job of getting testing done and providing testing services to pretty much everybody that needs it throughout Mobile.
Something else I've admired about you is that, well, I think we think a lot alike sometimes, which is scary in itself. But neither one of us are scared to jump and invest when we see something we think is going to work. We don't sit around. We don't overplan it. And I've noticed that in you is that you're not scared to invest.
No, at the end of the day, it's investing in the right places. We invest in compliance. We invest in reducing opioid use and dispensing. We invest in the laboratory to really make sure patients are compliant with the prescriptions that doctors were prescribing. And then COVID testing, there was a need there. There's a big need in limiting this disease from spreading, identifying the places that are hot spots and things like that. And really, it's a public awareness as well, just letting people know if they have it or not, the comfort of people having it so they don't go spread it in other places. And it's not going to go away anytime soon. So the investment of doing it and trying to get your arms around where your outbreaks are and things like that from a lab standpoint, talking about Mayor Simpson, a mayor standpoint, a governor standpoint, those are important for healthcare. And, you look at it right now, we're doing a lot of testing for physician offices, and those guys, they're doing surgeries. And the last thing they want to do is expose their staff to a patient that's positive and perform an elective surgery. So testing is big right now in terms of prevention. So it's something that's not going to go away anytime soon. And it's something that we felt was a wise investment to invest in, just due to the fact that there's just not enough testing out there. Even today, with all the labs that we have, there's just not enough. It's a supply and demand type of deal.
One reason I had you on the show is to get awareness out on the lab coming into town. It was here, but I think a message of when something possibly catastrophic can happen to your business, of stopping and looking around. That's been one of my messages forever is just stop. Don't panic. Don't stop crying and look around you. Take a step to the right from a different perspective. What opportunities are there as far as what your business can do? And you pivoted on a dime when you saw the need. And I've always said a need at a reasonable price is a win for a business owner.
It is. I also think I'm a big believer in whatever you do, diversification is a big deal. Diversifying your portfolio, diversifying within your companies, within your own company, and within each company. You look at the lab started off in toxicology, it's in PCR testing, it's in blood testing. So it's got 3 different areas that it's focused on and that it's diversified in. In DocRx dispensing, there's pharmacy sales, there's diagnostic sales, there's flu sales, there's dispensing sales, and then you've got the billing, and then the billing office, there's physician billing, and then there's also medical billing. So there's for dispensing. So there's multiple different facets that it does, and just diversifying it within your portfolio and businesses, I think, is big key. So you don't have all your eggs in one basket, because things change all the time, things move around, and to be diversified, you can usually lean on one thing when the other one might be going through a struggle, and then it bounces back, and then they swap places. So part of the deal of being able to do what we've done has been the attitude of diversifying our portfolio and how we do things.
No, I think that's really good advice for people. I think it can be applied in a lot of different ways. I see people who own more than one business. Yours kind of developed that way for liability purposes, compliance, legal, but it was really a smart thing that it ended up that way. I own multiple businesses, you own multiple businesses, and I think that it's very easy for one company that you own to become reliant on the other one, and it's not individualized. And so I think another message that people can learn from you is taking these companies, and we've talked about this, and a goal of, if you can make each one of your endeavors or ventures singly successful, where it's not dependent on another one, then that's just how many times can you win from that? And do you see that within your own companies?
I do. I will say, when we're talking about the companies and being successful, for us, it is always and will always be about the people. Just having good people that do the right things and do things legally, and realize that they're in something together, and doing something where we take a lot of pride in being a member of the Chamber of Commerce in Mobile, and focused on employing people in Mobile, and doing things along those lines where those people are just good all around people. Because if you got good people, you can do anything. I mean, I've always believed that. I still believe that. And if you ever find somebody who's a really good person and a hard worker, you've got a champion that you can put a lot on their shoulders, and they can do a lot of good. And for us, it's always been about patience. If you talk about good people, what are you doing for the patients? And those are the people that you look to try to do things for and try to help, because in healthcare today, there's a lot of different things going on. With COVID, people are scared. People don't know what's going on. They don't know if there's a cure. So being able to do the things that kind of ease their minds a little bit in terms of testing, research, trying to educate people, those are the things that we want to do and try to help people. So it's really a thing of, having good people around you and building your company off of that, but also the things you put in place to help others. And that's kind of one of the things that we kind of hang our hat on here anyway, and I think that's helped us be successful.
100%, couldn't agree more. And I do know a lot of your team, and you have a great team. I've always said that I want to hire people that are smarter than me in areas that I suck in.
Oh, absolutely. I'm surrounded by that, so, so that's a good thing.
Oh, absolutely. I think people fall back on being the boss too much, and they don't want to look, I don't know, stupid, dumb, whatever word you want to call it. And, I want to be the first one to raise my hand and go, all right, I was wrong. Y'all were right. And I think that's a big part of business.
Yeah, and I think too, I think when you sit in a CEO position, a CFO position, some of the higher president of companies, people look and they all want to manage down. And I kind of I don't really do a vertical approach. I'm more of a parallel approach. I don't tell people that I work with everybody here. They don't work for me. At the end of the day, I have an assistant named Raven Junkins, and Raven pretty much she people ask me all the time, how is it working for me? And I'm telling all the time, I work for her. My decisions that we make within our company, those decisions are important because her livelihood depends on it. She works here. Her income comes from here, and she pays her bills with her job and what she makes from here. So every decision I make impacts her and impacts all the people that work here. And when you do those things and you look at it that way, it becomes a little bit, sometimes it can be a little bit a heavy burden to carry sometimes, because you realize that people depend on you, but it also makes you think about your decisions, what you're going to do, your approach to business, and how you handle people, and where you go about investing and doing your business, because everybody that works here, we're all in this together. It's a group deal. And when you have good people, that's what makes it fun, because it makes it fun to come into the building. People ask me all the time, are you ever going to sell a company, get out? What's your exit strategy? taking a vacation. I enjoy being here. I enjoy being around the people. I don't really see myself not doing what I'm doing now forever. I mean, I'd be bored. And it's just a big pleasure to be around the people that are in these buildings. So I think when people look at that and they look at their people and they look at how they treat them, and they put themselves in a position of mentally being equal to everybody they work with, I think you see a lot of cultures that excel in that type of environment. That's the way I feel. I've always felt about it, and it's worked for me.
I really admired you. I heard you the end of last week tell somebody that was headed up the accounting, Mary Frances, headed up the accounting for the PPE, all the mask and every other supply you can think of, that you guys ramped up and were selling all over the place. I think you even sold to the was it the Boston Celtics you even sold to, if I can even,
Yes.
I say that on the show? That team was working hours and hours and hours, and you came in, you said, do not work this weekend. You need to leave at 5 o'clock. You have to go enjoy your life.
Oh yeah, there's a huge, there are a lot of studies done. There's a lot of things done on work-life balance. You know, I tell people all the time, you're supposed to spend 8 hours of sleep, 8 hours at work, 8 hours with your family. A third of your day is spent literally with your work, with your job. And, you know, if you divide your work up by thirds like that, if you can't get your job done in 8 hours, then we need to look at what we're doing. We need to look at hiring more people, or the things that we're doing internally that causes you to spend more time on a job. And, you know, you need to be at a place where you enjoy the people you work with. You need to be in a place where it is family, because you're spending as much time here and at these businesses as you do with your own family, when you think about it, when you're awake anyway. And I don't want to see people here over 8 hours and 40 hours a week doing work when they've got family and they need to split that, get home and do things there. So there is a big deal in work-life balance. There's a lot of studies that show, people who have a good balance there tend to be happier and do a better job and perform higher. So, you know, I don't want people to get burnt out on what they do. And that's something that I try to pay attention to, is what people are doing, their workloads, you know, and just how happy they are. I mean, at the end of the day, it's what it's really about. Just being with people and having them enjoy being here working for us and doing a good job, and let them understanding that we're trying to help people and help patients. So you put all that together, hopefully it's a place people want to work and want to be at.
And I think you've done a good job at that. I always told my teams, I want you to feel productive when you leave at the end of every day.
Absolutely. I think there's so much work here. A lot of times, particularly in accounting, people leave and, you know, there's still work to be done. So they feel like, you know, they need to stay over to get it done. But it's just getting them to understand, like, look, that'll be there tomorrow. We're good. You need to go home, enjoy your family, get away, and come back tomorrow, and it'll still be there. It's not going anywhere.
Work smarter.
Yeah. I laugh. Coming from a football background, there's a lot of coaches out there today, and they all have meetings, and some of them meet to meet. I've never understood that mentality. Get in, do what you got to do, and get out, and just be smart about it. That's what really, I think, is missing from today's world of business. People they find a lot of busy work, and it's not the things that they need to be focused on, and they're not working smart to be productive. It's just you're doing things that, yeah, it looks good, but it doesn't produce revenue. It doesn't produce results for what you're trying to accomplish. It's just, I call it fluff sitting over there that nobody's really going to use. At the end of the day, if you get people where they're working smart and effectively, they can do it in a timely manner that it needs to be done in. So that's kind of my attitude on that piece.
You've got to be the biggest LSU fan I've ever met.
Well, it's been interesting. I went there from 90. I was there from 91 to 96 playing, and then been big LSU fans our whole lives. But your children will change that up on you sometimes and throw a wrench in the whole deal. So we picked up South Alabama when my daughter went there and worked in recruiting. So we kind of became big local South Alabama fans. And now my son has signed and is going to Ole Miss and play. So now we are, which is going to be really hard for me, but we'll get it done. We're flipping over to the Ole Miss side, and we'll support him and his team and the Rebels. And not sure how the emotions will fly when LSU plays Ole Miss, but outside of that, we'll be big supporters of them and look forward to spending weekends in Oxford. And I've heard a lot about it. Haven't really seen it, but outside of the visits and stuff we've been on with him. But looking forward to that. So that'll be new and different. So that'll be a lot different.
Yeah, my nephew went to Auburn, is at Auburn now. So I'm just going to say roll tide and go SEC. I don't know what else to say to that.
That's really all you can do. I don't think he was expecting us to get rid of all the purple and gold in my office and in our home, but we found a little room for him to put his red and powder puff blue. So we'll let him have that little section.
Hey, Johnny just sent us a message. Brian, can I come work for you?
Yeah. The way we're growing right now, I mean, there's always, who knows what an opportunity to have, Johnny, so you never know.
Well, I'm going to go ahead and kind of wrap things up. Number one, I want to thank our sponsor today is Payroll Vault, and they're for your PPP needs and all your payroll needs. And two, this show started out about being excited that watching a business owner see a need in bad times and coming up and doing what he had to do to be able to put that in place, and a new lab for COVID testing coming up in Mobile. Not just COVID, but many things, employing people. And that was an exciting thing. And I think it's also, this show has led into a work-life balance and how somebody who respects his people, how that can add to the success as a business owner. I think it's a powerful message for people today. And I want to thank you so much for coming on. And again, about Coast Diagnostic Labs, which is only one of your companies, tell people, give them 60-second elevator pitch of how to get in touch with it and where to go.
If you're looking for testing, whether you're a business or a practice or a physician practice, or if you're looking to get COVID testing done for your employees or, like I said, for your healthcare clinics, our phone number is 251-459-8409. You can find us at www.coastdiagnostics.com. I think at the end of the day, we can offer a good bit of services in terms of the COVID testing, doing the antibody testing, the PCR testing, and with the swabs and so forth. So if you need that done, or you're looking for something along those lines, give us a call. But I also want to say about the sponsor. I mean, it's really interesting. As when my first job out of college, I worked for a company called ADP, which is the largest company in the country for payrolls, and that's how I cut my teeth into payrolls. My first job, and selling was interesting, but moved on into healthcare and pharmaceuticals, and we use Payroll Vault, and it's having worked for the national standard in the industry and having a local company, I see more benefit from the local company and Payroll Vault just because they're local. You get faces and things like that, and people can help you when you need them versus having to go through a corporate 1-800 number and be put on hold and wait for things. That was one of the things that I always had trouble selling against when I worked there. So, helping those people and helping local. That's one thing we got out of COVID, was helping local companies and help local businesses and support your local people. And that's what we're trying to do, and that's what we want to do with the COVID testing is support everybody in Mobile that needs to be tested. And that's something we work with the mayor on, and the other lab in Mobile is, if you need testing, using the two of us to do your testing locally and support local businesses here, because we can get your results a lot quicker. We can do things because we're here in person. And I think Payroll Vault is another great example when doing payrolls. If you can use a local company versus a national company, and that's a big benefit to you. So that's my take on that. If we can help in either way, thanks for having me today, and thanks for the time and letting us talk about our story and what we do. Anything we can do to help, let us know.
Well, cheers to you, Brian Ward, but especially cheers to your team. The team you put together that's adding to your success, and I really appreciate the sentiment. So thank you so much for coming on the show.
Hey, I appreciate it. Have a great day.
You too.
Please be sure to subscribe to Cheers to Business podcast on iTunes or anywhere else that you get your podcast. Visit our Facebook and be sure to give us a like. And if you have any questions or topics you'd like us to discuss, shoot us an email from the website cheerstobusiness.com.